We will get started here. Welcome, everyone. Thank you guys for tuning in. This is the Performance and Sports Science Study Group. My name is Nick Simi. I'm from Northeast Ohio. For those that don't know me, I went to undergrad at Ohio State University, physical therapy school at the University of Dayton, and then did my master's in athletic training at Kent State University, so stayed in Ohio. And this past year, I've been working as the head athletic trainer and physical therapist for the Grand Rapids Gold, which is the G League affiliate of the Denver Nuggets. And then I'm welcomed here with partner Daniel Yu. If you want to give a little bit about yourself, Daniel.
Hey everyone, my name is Daniel, originally from Jersey. Went to school, did my undergrad at UConn, then went to KU. Currently, I'm working in the NBA as a sports scientist for the Orlando Magic. Really excited to have you all join us here tonight.
And we also want to thank Dylan. We'll do a little introduction here. So appreciate you, Dylan, for hopping on today. He is the clinical marketing manager for VALD. He's been in that role for the last 2 years. He also works and treats patients at Headquarters Physical Therapy and is also a physical performance coach at E4 Sports, affiliated with high school and middle school athletes. He got his bachelor's degree from California Polytech State University and his doctorate of physical therapy from Thomas Jefferson University. And today we'll be talking about return to performance post hamstring injury. So, Dylan, thank you for hopping on and sharing your insights and knowledge tonight.
You guys, I'm pumped to be on here. Nick, you got rid of the part that I always hate talking about, which is myself. So thank you for doing that for me.
No
And
problem.
now we get to just start chatting more about hamstrings. Get a little bit more time for that.
The one thing I will add, so I want to make sure everyone can see Dylan's screen. And then as we go through, Dylan's been gracious enough as you have questions, just drop them in the chat. And Daniel and I will be moderating that throughout the session. And we'll go through those question and answers as we go in real time instead of waiting towards the end. So again, appreciate you guys' time. And Dylan, the floor is yours.
Awesome. Thank you guys. So first of all, I mean, one thing, thank you to Nick and Daniel. This is an awesome opportunity for myself as well as to give Vault a little bit of exposure for anybody who hasn't heard about the company and their systems and things like that. So really excited to just kind of dive into all things hamstrings injury. The fun part about this is for, like I had said before, if anyone's unfamiliar with the company VALD, they make sports science and sports technology equipment mostly centered around monitoring, managing, and tracking different physical capacities that individuals have. Their first product launched in 2016, and it was the Nordboard, which is the system that you see this individual on right now. So it is fun to just kind of have a brief moment of acknowledging the fact that this is kind of where Vault started, and even though they're now a larger corporation that has 9 or so systems, we always just like to acknowledge where we kind of came from. So, as I said before, I'll scan through this really quickly. Nick gave my background, where I went to school, and all these sorts of things. Um, Based on my role within Vault, the title is quite vague and means not really much. And so the experiences and sort of things that I'm responsible for with Vault are largely on our kind of long form educational content. So if anybody has seen any of the practitioner's guides to different technologies or to different entries that have come out in the last year and a half, I kind of work with and help edit, draft, and kind of coalesce a lot of those articles and a lot of those guides together, just so that we can kind of provide as much information to both users and what we like to think of as future users in the space. So I do also have a hand in clinical practice still. I still treat and coach as well in Bend, Oregon, in Central Oregon here. And yeah, just been loving what I've been doing recently. And so looking to continue on. But diving straight into hamstring injuries, they suck, right? They've only grown in their total slice of the pie over the last 20 years in terms of how in terms of their chunk of incidents within things like professional football or professional soccer. Now, that doesn't necessarily mean that hamstring injuries on a large scale are on the rise. I think what it really just shows from a like epidemiology standpoint is that we've gotten really good at managing a lot of other injuries, i.e. tendon injuries or contusions or other random things that happen within sport. However, hamstring injuries have just been one of those things we don't have a good grasp on just yet. Or they continue to kind of meld and mold with the new insights that we start to kind of glean from them. So, as the slide says, right, the incidence has not declined in hamstring injuries over the last 20 years, which is very shocking. And so, rather than just looking at incidence, however, practitioners should probably be looking at something that combines incidence and severity, right? Which is something that we talk about is injury burden. And so, injury burden is something that is really important and something that's really helpful to visualize because sometimes some of the smaller or the more quote unquote typical injuries that people are always just like, ah, yeah, it's a pulled muscle, you'll be fine. Those are the things that actually have the highest injury burden. Whereas you look at things like ACL injuries or bone breaks, right? You have a lower leg fracture, things like that. Those things may have a large acute phase and a very specific moment that gets a lot of coverage time and these sorts of things. However, when it comes to total burden, there's a lot of days lost per injury, but the injuries don't happen as frequently. So being able to plot things on this type of a chart is really helpful for practitioners to say, okay, what really matters, right? We can see down in this bottom left corner, you get a laceration, right? Or a concussion or things like that. Obviously, there's severities to all of these sorts of things. But when we look at the data, we see that both of those things don't happen as often. And when they do happen, they don't take a lot of time away from play. However, when you look all the way out, we see hamstring injury as kind of a bit of an outlier over here where it happens really often, right? The number of injuries per 1,000 hours is pretty much at its max right here. And it's about a moderate time away from sport, right? Return to play times can vary significantly within hamstring injuries, obviously depending on grading and severity. It can be as little as, a week, but it can also be as long as, 40 to 50 days in some longer cases. And hamstring injuries are quite recurrent, Like we said before, we don't always have a really strong grasp on these sorts of things. And so a lot of times we think we did our best job or we gave it our best shot at managing some of these injuries, but they come back to bite us again. And so we're trying to really discern and tease out why is that. And the best way we can do so is trying to look at the individuals themselves that got injured in the first place and say, what's different about this person versus the people that didn't. So when we look at not just burden, but just kind of the archetype of a person that tears their hamstring, we see from an athletic standpoint, a lot of times it's these sort of mid to late athletes, right? When we think about professional careers, a lot of times individuals are going to peak in their late 20s and then go into their 30s, depending on the sport and all these sorts of things. But understanding when hamstrings happen the most, we see a large spike and increase. Obviously, this doesn't have as much granularity as we'd like, but this spike actually occurs right after the age of 25, right? So we see a lot more people start to tear their hamstrings and hamstring injuries become a lot more prevalent after the age of 25. And so we always think about things and we always, use this idea of quote unquote age as this risk factor for any kind of muscle injury, right? You can think about a calf muscle strain, you can think about hamstring, groin, quad, all of these sorts of things. Age it almost always plays a factor in that. We'll get into why that is maybe in a little bit. But depending on, again, I came into this not 100% sure on everybody's background, whether it was strictly on the sports science side, strictly on rehab, or somewhere in the middle. So I just gave a very brief and kind of shot in the dark of basic anatomy just so that everyone's on the same page, right? So we obviously have bicep fem, long head, and short head that are going to be some of the more pertinent areas when we think about hamstring muscle strain injuries. Similarly, we'll hear things like the T junction get thrown around a lot. For those that haven't heard about it as much or are not as familiar, as you guys can imagine, there is the long head and the short head of the bicep femoris. So long head is going to be this lateral muscle right here, and then short head is going to originate on the linea aspera, which is just a ridge on the backside of your femur, and it probably starts right around here where my cursor is, and then they will join in together distally somewhere around here on that distal femur, and then they will insert together in a conjoint tendon on the lateral aspect of the tibia as well as a little bit on the fibular head. So what the T junction is where those two, the long head and the short head, converge together, right? And so when we think about some sort of a new type of an injury or an injury that has gotten a little bit more traction as of recently, we think about T-junction injuries because there's been new research that is kind of up and down about, are they relevant? Do they delay return to play times? Do they not delay return to play times? And all these different things. And so what could be the manifestation of this is like we talked about earlier, where we have this lack of a change in our incidence rate over time when it comes to these hamstring injuries. You can ask some experts, and a lot of the hypotheses may surround, well, there's different innervations depending on the individual, right? Everybody doesn't have perfect anatomy. And so there will be in some subgroups different innervations between the long head and the short head of the bicep fem. And so there could be reasons of, well, these people have really strong hamstrings because we know that hamstring strains are an issue. So we train hamstring strength. However, there could be emerging new patterns that are coming about that change neural firing patterns or that change something else that could be the reasoning why we see this lack of a change in hamstring injury kind of incidence. Other muscles, obviously, we have semitendinosus and semimembranosus. They'll all kind of originate right on this conjoint tendon up at the top of pelvis on the ischial tuberosity, and then they will insert down distally towards the tibia, whether it's through their own tendons and things. Now, mainly when we think about the function of the hamstrings, from a biomechanics standpoint, yes, they're going to extend the hip and they're going to flex the knee. They're biarticular in nature. And so those are going to be the more basic properties that they are going to be able to do. However, the largest thing that a lot of times people will think about is the sprint type mechanism with hamstring strains. And so the largest function that the hamstrings play in that is to decelerate the tibia as it's swinging forward in that terminal swing phase of sprinting. So for those unfamiliar, obviously the gait cycle, and as people are sprinting, an individual will, right before their foot strikes the ground, their shank or their tibia, their knees extending it over the swing phase. And as that is happening, the rotational velocity that's happening at the knee joint is around 1200 degrees per second, right? So when you combine that massive amount of velocity with the weight of the lower leg, you have a lot of momentum going into the hamstrings that are responsible for decelerating that. So what can happen a lot of times is it's either this quasi-isometric to eccentric contraction that occurs, or there's just this habitual overload and overstriding right at foot contact, where we then see a super physiologic load go through the hamstrings, which causes either the muscle belly, the MTJ, or some other structure within that knee flexor mechanism to go to strain. So when we look at other areas and when we talk about intramuscular tendons or muscle tendon junctions, right? If there is a specific injury to those sorts of structures, right? If we have an intramuscular tendon insult, that is going to be associated with a slightly prolonged return to play time, especially when we see that in direct sprinting populations. So when we think track sprinters that pull their hamstring, they get imaging and we see that there is an intramuscular tendon tear or some sort of aponeurotic disruption, then we start to say, ooh, we might extend that, what would have been a 21-day return to run timeline now probably gets kicked out to 28 to 36 or something like that days. From there, we can also look at, what the function of these intramuscular tendons are. When we look at aponeuroses and intramuscular tendons and T-junctions and all these sorts of things, we don't necessarily think that the tendon itself or the free tendon is going to behave the same way as an intramuscular tendon. Intramuscular tendons, because they are built within the muscle, are getting pulled in a multi-directional fashion and facet. We see this a lot within the calf as well, where most of the time you don't get that same stretch shortening cycle or that force amplification that you get within these intramuscular tendons, because they're getting pulled in so many different directions and from different angles, that this kind of nice stretch and relaxation that will amplify most of the force production from muscle doesn't necessarily occur. And so what we now start to see is these are just supposed to be really strong and robust structures that are meant to transmit forces mostly. So when we think about that and then we say, oh, well, now this structure is disrupted in some way, shape, or form, well, now we have a more or less a break in communication between one part of the muscle and the other because these attachment sites are now disrupted. So these are kind of some of the basic anatomy justifications for why these sorts of things are relevant. When we dive a little bit deeper into what makes a specific hamstring muscle more risky to sustain an injury than another, we often look at fascicle length. Fascicle length and muscle pennation angle are going to be inherently intertwined because if you have a longer fascicle length, you have a shallower pennation angle, and it's also going to be related to the total muscle volume itself. So there's this kind of interesting relationship between total muscle size, muscle fascicle length, and muscle pennation angle. So when we see a wider pennation angle, that normally indicates a shorter fascicle, or a shorter fascicle length. And we see that most of the time that means that that individual cannot tolerate high speed loads at long muscle lengths, which generally, when we see an adaptive response to either sprint training or heavy eccentrics, we see that bicep femoris long head fascicle length increases. And so the idea behind that is then to say, oh, okay, well, if we see that these shorter fascicle lengths increase injury risk, but when we get closer to doing the terminal task that is sprinting or that is playing in their sport, there's an adaptive response to increase that length. Well, what we should probably try and do in training is to augment that response, right? So when we find things like eccentric training, such as Nordics, RDLs, or razor curls, these things are also going to help increase fascicle length to provide protective adaptation for the hamstrings. Now, similarly, a lot of times people will kind of present, not necessarily even an argument, but they will say, well, hey, you just said it's 1200 degrees per second that the knee is extending during swing phases and things like this. A Nordic is inherently executed very slowly. So what is the point of doing something so slow that is in theory not going to transfer over to that high velocity movement? Which I think is a very valid question. A lot of times those sorts of things happen. But the biggest thing that I always will think about and try and zoom out from is we have to detach the exercise that we're selecting to create the adaptation from what that adaptation is benefiting the individual from. So we do eccentric training because it increases the fascicle length, and we know that fascicle length is going to create a protective effect because the longer a fascicle is, the more it is showing that the muscle is capable of producing high loads at long lengths. And that is like more or less the proxy measure for fascicle lengths. So that's why we are then able to say slow training for the most part, and especially early and middle phases of hamstring rehab, is totally fine because we are chasing a structural change in the muscle. We're not chasing a specific output that that individual is supposed to express on the field or on the court. What we look for from there is once we have accumulated enough time and volume doing these heavy eccentrics, we can then assess through different proxy measures. And this is where technologies that VALD produces come into play, right? We can do a Nordic on the Nord board. We can do an isoprone on the Nord board as well, which is just an isometric assessment using Nord board. We can do the 90-20 hamstring isometric, which is very specific to that swing phase in running that just assesses peak forces and rate of force development in very specific positions. And we can also look at specific waveform or force trace analyses with Nordic hamstring exercises so that we can then look at, okay, what is this showing us beyond just what the peak force or what the impulse says that we're getting from this technology. So what we always try and push for is doing some sort of a long lever eccentric as long as it's tolerated from the individual standpoint, right? So this is just kind of a more basic overview of expectations and what we kind of do. When we look at risk factors associated with hamstring injury, I said before, age is almost always one of the number one risk factors. And once you hit that 25 mark, right, even though it's relatively young for all of us, we see an uptick in hamstring injury. For individuals that have a healthcare background or things like that, you may be educated in what the aging process as a whole looks like, right? So when you zoom out and you just think, all right, we're taking our sports cap off for a second, we're just looking at a human being going through the aging process. Well, most of the time, what happens is that individual gets slowly and slowly lower and lower muscle mass that will also reduce their or that increase their pennation angle and reduce their fascicle lengths. It will also, they just inherently will reduce their activity level. They will decrease bone mineral density. They will decrease total volume and muscle size and strength. So we kind of reverse engineer it and say, okay, maybe it's not just the fact that 25-year-olds and 26-year-olds and 27 and all the way up now have an increased risk. It's maybe there's physical qualities and physical things that are changing beneath the surface as that individual ages that we can then go and dive deeper and start to prevent those physiologic processes from happening, or we can at least push them further down the road. So when we look at risk factors, obviously previous hamstring injury is kind of a no-brainer, right? If you had one in the past, you're considerably more likely. I think the number is now around 8 times as likely to have another one again. We think about things like muscle strength and balance. A lot of times, where I remember when I was going through PT school, it was kind of in this nihilistic phase where it's like, well, nothing really all that much matters, and muscle strength balances are all kind of arbitrary. So why do we even bother? But when we look at some of the data that comes out, we notice that we need to at least have some sort of a balance when it comes to coordinating the amount of load that that individual is experiencing. So if all this individual can do is take load through their quadriceps, well, if there's one fluke accident where they get put in a position where they can only use their hamstrings to do something, well, they're very disadvantaged at that. So we need to have some sort of a quote unquote balance to make sure that if they're put in an awkward position, such as this individual right here, they either have enough flexibility or strength or motor control or some physical quality that allows them to tolerate those positions so that injuries don't happen. Similarly, we look at neuromuscular control. We can dive into some of the pelvic mechanics and things like that that occur with hamstring strains. We also know that the total volume of high speed running, right, up to 90+% of your maximum speed, the total volume of that will also be a potential injury risk factor. And then, like we had said before, kinetic chain influences are always going to be a factor when we're thinking about injury risk and injury management. So, where does that bring us? Well, when we look at different injury types, we are going to have a couple of them. We are going to mainly have, the sprint type in the very center is where most of these injuries are occurring. Um, like we had said before, that late swing phase is going to be the main issue when we think about injury mechanisms. However, accidents happen, right? So we do have that stretch type mechanism where it's more common in dancing populations or in performing artists. But if you get overstretched, if there's a slip, if there's a fall, these types of injuries also tend to happen in the older age groups as well, like 40s, 50s, 60s, 70s, when there's an accident that happens and somebody tries to catch themselves. When we say the compression type injury, what we're really talking about is proximal hamstring tendinopathy. So we see this a lot more in powerlifters or in individuals that participate in a lot of deep hip flexion ranges. We also see this in sedentary populations that are desk workers or are truck drivers or things like that, where they're consistently sitting on their ischial tuberosities, compressing that proximal hamstring tendon, which tends to get irritated, right? So we have a lot of these sorts of different types and different mechanisms, which will all influence how we grade and expose this individual back to their sport, right? If we see something as a one-off stretch type muscle injury that is, less severe and, maybe it's a grade 1, it's within the muscle belly and they're okay, then by and large, we say, hey, this was kind of a fluke accident. Yes, we're going to make sure that the capacities that this individual has are maintained and even provide a buffer for them so that they're a little bit stronger, a little bit faster, and a little bit more robust when we send them back. But we also can hang our hat on, okay, this was an accident, right? This wasn't a recurring thing that we know could happen again and again and again. Obviously, it could happen again. Accidents will always be a part of sport. However, the likelihood is, just as likely as it was beforehand. I always akin these sorts of things to how much of a re-injury was just chance that that injury happened again, and how much of it was the fact that they had that injury beforehand. And so when we think about this accidental stretch type injury, well, most of the time I go down it's kind of a fluke accident, kind of a fluke incident. So it's unlikely to occur again, or if it does, it's unlikely that it was because they got that first injury. Whereas if we look at the sprint type and we see a track sprinter that is, semi-professional, had graduated college and had one or two, and then as they ramp up their training again, they consistently get that same injury. Well, now we start to look at, okay, this is an increasingly risky factor that we're trying to address and figure out what is the thing that's holding this person back. So this is kind of how different injury types and different injury mechanisms are going to play into this.
Dylan, we have a question here in the chat, if you don't mind
Yeah,
me.
for sure.
Yeah, so our question was, could you talk about some of the literature surrounding variation in anterior pelvic tilt and hamstring injury risk, or any insights on that?
Yeah, no, I mean, this is perfect timing. So this slide is very helpful. So Chris Brahma is a very, I'd like to think, well-known researcher that has done a lot in the running mechanics and kinematic space. And so they did I believe it was a systematic review. It might have been a scoping review. My apologies. But they looked at a bunch of different papers and said, okay, where is most of the evidence lying when it comes to injury risk and when it comes to positions for straight line sprinting. Um, so this was just a stylized version of this paper, but more or less they grouped it into three different areas. There was more of like total number of papers and strength of evidence were the kind of categories. So they had like these top four, then these middle two, and then this last one. So we have forward trunk lean, lumbopelvic control, anterior pelvic tilt, and maximal hip flexion angle are going to be the top four, you know, positions that you can kind of hang your hat on as a practitioner if you were assessing somebody sprinting to say, if we can modify some of these, I'm a lot more confident in this individual reducing their risk profile, right? However, it doesn't necessarily mean that that is the thing. You still need to make sure that they have adequate capacity in both the hamstrings as well as some of the surrounding musculature. However, if we take something like forward trunk lean, for example, uh, you can kind of imagine if everybody just bend forward and touch their toes by leaning their trunk forward, you would feel a stretch in your hamstrings, right? So we can kind of then rationalize, all right, forward trunk lean makes sense. You're going to increase the strain on your hamstrings by doing so. So if you're chronically in a excessively leaned forward position while you're trying to sprint, while you're just putting more strain through the hamstrings at high loads and high speeds, that could be one of the factors that can increase your risk profile. Lumbopelvic control kind of plays a similar role, and I know the question was specifically at anterior pelvic tilt. A lot of these things are kind of very intrinsically tied, which in my opinion is very ironic because you see something like lumbar extension under the theory category when you think about pelvic control, anterior pelvic tilt, and hip flexion angles. Like all of those are also going to influence the lumbar extension position, right? So anyway, all of this I probably should have prefaced at the very beginning. I go on extreme tangents. So if anybody wants to reel me in, just unmute and say, "Hey, let's get it back together." But what we're looking at here when it comes to anterior pelvic tilt and these sorts of things is um, more or less you are looking at a position or when you're coaching for sprinting and things like that, you are always trying to optimize for the length tension relationship of the hamstrings. So we know that when you think about that length tension relationship within muscle, like you will see that generally within the mid range, most muscles will produce the most amount of force. There are some passive proteins within muscle that help it out at end ranges because there is less cross bridges. So you hear about proteins like titin. It's a very interesting thing if people want to go down a deep dive rabbit hole. But when you are coaching, you always say, okay, when this person's sprinting, how can I maximize the amount of time that this person can stay within the mid range of their hamstring length tension relationship? Because that's where we know they're going to be the strongest. Now, obviously, there's going to be some overlap, and there's going to be times in which they're not in that position. We just want to maximize the total time that they're there. So when we think about these sorts of things, um, anterior pelvic tilt is going to increase the total stretch on the hamstrings because it's the same thing as forward trunk lean, right? You're literally, your pelvis is just rotating over top of your femurs, meaning that the distance from your ischial tuberosity to your knee joint is getting longer. And the thing that connects those two structures is your hamstring. So the hamstring is being lengthened when you have that anterior pelvic tilt. Similarly, when you have an anterior pelvic tilt, normally your center of mass is slightly forward, which is going to cause you to overstride a little bit more because your relative position of your foot needs to be further in front of your center of mass. So it's kind of this, 1-2 punch where you're already stretching and stressing the hamstrings by tilting your pelvis forward. But by doing so, you're also pushing your center of mass a little bit more forward because you're leaning. And that is causing you to overstride even more, which is placing even more tension on your hamstrings. So a lot of times that is almost the number one thing that coaches will try and mitigate because they know that it's one of those central like kind of cascade of events that will occur. Um, I'm gonna probably try and jam through some of these sorts of things. Deficits in glutes, adductors, quads, or calves. Also, if I didn't answer your question, please reach back out and we can chat about it as well. Hopefully I did. But these sorts of accessory muscle groups are actually incredibly important. And I think it's probably one of the most common areas that people miss within hamstring rehab. and the recurrence of these sorts of things, right? We know that, when we look at things like calf force production, most of the time people rarely train calves, but they do plyos or they do these sorts of other things. And when that occurs, well, you just have a deficit, and we have like anatomical evidence showing that the calves and hamstrings actually have these like weird fascial connections to them, to the point where we know that there's going to be load sharing between those two structures. So if the calves aren't pulling their fair share, well, then we know that the hamstrings are going to be a little bit overloaded. So we need to make sure that you have adequate calf strength. We need to make sure that the quads are there as well to be able to decelerate once you hit the ground. We also want to make sure that glutes and adductors are there because adductors are also going to help with hip extension, as well as they're going to help with pelvic stability. And we know that if there's increase in pelvic rotation, or if there's increase in side bending and these sorts of things, it's really important to make sure that doesn't happen, because it can increase hamstring release. Let's see, is there anything specific here? Biggest thing, I think, when we think about gluteal performance and these sorts of things, if for those individuals that are in PT school, remembering like the paired motions that accompany the lumbar spine, right? So if you side bend to the left, the facet joints will kind of push you to rotate to the right. And those sorts of things can also be helpful to think about, because if you see somebody who constantly saunters when they run and leans super far right, leans super far left at each foot strike, you can also think about, well, if that's happening, then there's also more rotation occurring at the pelvis. And that's been a newly proposed risk factor for hamstring strain, is that there's an increase in rotation at the pelvis, whereby if you are, let's say you are in mid-swing phase with your right leg, and your right leg is about to hit the ground when it's at its most stretched point from the hamstring, if you rotate, and if you rotate to the right, so you're rotating over that same right leg that's swinging, you're essentially pulling that pelvis backwards, right? So you're increasing the total amount of strain on that muscle belly. So again, you may increase hamstring strain risk. So my apologies for taking way too long to go through some of those mechanisms. Now onto the fun part. When we think about testing technology, we always just want to appreciate what it is that we're looking to test first, right? We always want to say and take a zoom out and say technology is amazing, right? I have a very large bias considering I work for a testing company, more or less. However, we need to always say, okay, what is the result of this test going to do for me? And if that is, well, I don't know, I'm just going to test and figure it out later, you should probably reassess what it is that you're trying to look for. So making sure that all of these things probably test hamstring strength in one way or another, but being able to have a rationale for why I would do a prone, single or unilateral heel dig in a prone position at 30 degrees versus doing something bilateral also at 30 degrees. Whereas sometimes people would want to go seated or do a more like max effort INTP, right? So being able to understand why you're going to choose those sorts of tests and what value they bring is going to be incredibly important. So when we look at a sort of system-wide assessment of strength and functionality, we are going to make sure that we test at multiple angles, right? Because we know that isometric strength only has about a 10-degree carryover for a more lengthened or a more shortened position. So if you do an assessment at 30 degrees, that doesn't mean that it's going to give you the same amount of information than if you do an assessment at 90 degrees. Especially people know this if they are working with somebody with an ACL from a hamstring graft, you know that deep knee flexion hamstring strength just kind of goes kaput. And similarly with hamstring strengths, right? So you always want to make sure that when you're doing an assessment, you understand what it is that you're testing for. So I always like to call it the sensitivity versus capacity spectrum. We know that, like we said before, short lever testing, right? So if you do a, prone 90-degree heel hamstring test where the hamstring's already pretty shortened, you will see deficits for a longer period of time, right? You're not necessarily testing peak hamstring strength in that position because, again, that length tension relationship doesn't allow you to do so. However, what you are able to do is use it as a very sensitive test to detect if there's still something going on within that hamstring. So this would be a great thing where if somebody has recurrent hamstring injuries and they're prepping for a meet, they feel really good, right? Then you can say, all right, well, we'll do a max effort test where we know we're not going to put a ton of load through them because they can't physically produce a lot of force. So we can use this assessment as just a quick proxy and a dirty screen to say, hey, how is this thing functioning even at suboptimal positions? Whereas if we look at long lever testing, that's going to show the true tensile capacity of that tissue, right? So that's when we break out things like the Nordboard, force frame, or force decks and put them into those maximally either stretched or elongated positions, and do that, eccentric testing under length or isometric testing under length. Um, when we do eccentrics, right, there's always going to be information that we can pull from it other than just peak force, right? We can look at, just like when people think about counter movement jump profiling or drop jump profiling or whatever the latest and greatest thing in force plates is nowadays, they'll always say, look at the curve. The curve will tell you something, right? So it's the same thing with a Nordic, right? These are all 4 different attempts of different individuals executing Nordic hamstring curls. But as you can always obviously see, the execution is very different, right? So in this scenario, this individual was going, 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 and then they just stopped themselves because they weren't able to tolerate anything. Either they had a some sort of a pain response if they went too far down, or they just didn't have that lengthened capacity of the muscle anymore. So you can see the force trace just kind of flat lines once they get to a specific angle, and then they hold for as long as they can, and then they just drop. So that's an important thing to consider and say, well, that shape is very different from this shape where this person just kind of goes and goes, and then they just kind of give up, right? They ended prematurely, but they didn't have any fight left in them. So what that's going to tell me is this is probably their first or second time doing a Nordic. They don't really know what's going on, or they're very fearful because this is one of the first times they've done it post strain injury, right? So these are some nuances that we kind of tease out here. This can also be somebody who maybe doesn't necessarily know what it is that the individual wants them to do. And so what they'll do is they'll just go super slow and kind of go for as long as they can, and then they just kind of slowly fade out. To be honest, even though peak force isn't very great here, you can see the area under this curve or the total impulse from these sorts of things, from this execution is probably the highest, right? So this is something that we can say, well, yes, sure. Are they compensating for something? Maybe. However, they're taking their time to be able to do this. So this might be somebody who has enough, true muscular characteristics. But when we think of their tendony, kind of fast twitch, all those sorts of things, that might be your what you take from that and say, oh, okay, cool. Well, maybe now we should just start working on high rate of force development type exercises. With this one, twisting is a little interesting. So you can see right here I'll show you guys in a different force trace, but this individual starts by producing more force on their right side. So orange, within everything within VALD, orange is right, blue is left. So you can see they start producing more force at the very beginning with their right side because they kind of know, hey, I really don't have much on my right. My left is going to take over at some point, but they kind of know that and they want to get enough load onto that side. So they're more or less compensating for their lack of peak force capacity by trying to hold on that right side for a really, really long time, and then they die, or their execution kind of fails. This can also, you can physically see this individual twisting because they started more on the right side and then they started to realize, well, left is going to take over at some point. So you can actually physically see the individual rotating.
I
This,
have a
like I said,
question about that.
yeah, yeah.
Do you find value in using video footage or anything that can measure like the break point angle and
Mm.
coinciding that with any training at that specific break point, or is there any insights or information on that?
Yeah, definitely. I mean, it's always like 8 million different factors that you can kind of rationalize around. So yes, there's always going to be a breakpoint angle. However, in my head, it's like you're not getting to the optimized length tension relationship of a Nordic for the hamstrings until close to the end because you're always in a hip extended position, right? And so it's what it likely is, like you're saying, Nick, is you hit that break point, but it's most likely just the total amount of torque about the knee joint that individual cannot tolerate. And so there could totally be rationale for doing that. Normally what I do and what I see is that is like, okay, that person just their hamstrings are just weak, right? And so rather than me like trying to like reconstruct a banded situation where like they're right at that same break point so that they can practice isometric and do something like that, I just say, you know what? Let's just get your hamstrings a little bit stronger through whether it's more Nordics, whether it's RDLs, whether it's some other things, and let's see. And a lot of times it just kind of their break point now shifts a little bit further and a little bit further. And so I think there's like we said, there's a million ways that you can kind of get an intervention to do what you want it to do. I've noticed that you can definitely do that and find the very specific position. You can also probably be a little bit more general if you have the affording kind of scenario to do so, and you should be okay as well.
Appreciate that.
Yeah, for sure. Thanks for the questions. This is just another example. So this is a counter movement jump done by an athlete that is like one of their first jumps post ACL reconstruction. Um, Zach, I can take a peek at your question. Um, do you cue athletes on hip flexion angle? For example, if they can't hold 0 degrees to drop the rep, how do you create consistency in the testing? Really good question. Yeah, so with this, when it comes to consistency with Nordics as a whole, I will always say, like, there's always going to be that like anterior pelvic tilt as people go down because again, they're intentionally doing is they're lengthening their hamstrings to get to a better length tension relationship at that point, because they're already so shortened when their hips are extended and they're kneeling, right? So that's like almost maximal shortening of the hamstrings. So then when you put that under a really heavy load, the body's going to automatically compensate by dumping the pelvis forward to elongate the muscle a little bit so that it gets into that kind of center fold of the length tension relationship. When it comes to cueing, it's actually very interesting. I'm a big person of trying to make sure that somebody is set up in the right position for the test to go. What I will always tell somebody is, you know, try and start out hips forward, make sure that there's a straight line between your shoulders and knees the entire time. If I notice that they are truly like bending, like and just more or less doing a razor curl instead of a Nordic, I'll take a dowel and I'll just put it in front of their knee and I'll just have them hold on to it because then they'll physically feel that actually like hitting them. Right. It's the same thing as like, everybody learns how to, teach the RDL by putting a dowel on your head and mid back and pelvis or on their sacrum. But with that, if you just put a dowel in front of one of the knees, right, and just say, hey, knee, pelvis, and shoulder need to stay in contact with that dowel the whole way down. That can be helpful, but it's also a little scary because they still need to catch themselves. So normally I just say the test is going to test them from a hamstring perspective. If it's so ugly that I don't think I'm getting the right data, then I just say, well, this isn't the right test for that person. And so then we just go to like an ISO 60 or an ISO 30 or something along those lines because it's going to be a little bit more effective. But yeah, hopefully that answers your question. Um, this is just a really quick example of the same idea that we talked about above. So like the individual starts out a little bit more biased on the right side and they quickly shift to their left. Same pattern emerges when you see people post ACL with jumping. So this individual, when you look at takeoff, you can more or less rationalize, all right, they probably did their right ACL because they have a really large left to right asymmetry and the left side is really taking over at the end. But you can see they really started out by having a lot of weight on their right side at first. And then as they dip down and then they start to reload into their limbs, then the left side starts to shift over and take over. What we kind of attribute this, or what I kind of attribute this to, is this individual knows that they don't have the capacity on that one leg. And so instead of going through this large change in total amount of force that they're going through of even distribution, unweighting, and reweighting is going to be a lot of difference in terms of total force change for that individual. So if they start high and then they don't unweight that much and then they come back up, the left side goes down and up like that, but their right leg only has to go through a very small amount of change in the total force that it has to undergo. So it's easier for them to handle that and to not have to decelerate as much momentum on that side. When we look at assessing with Nordics, we don't necessarily just want to focus on slow Nordics. We can kind of execute them fast. When we think about metrics, I'm trying to go a little bit faster to be conscious of your guys' time, but when we think about these sorts of things, peak force is always going to be king early on. How much force can that individual produce in those positions? Asymmetry is really important to understand strategy, but make sure that we're looking at peak force asymmetry rather than impulse asymmetry, because sometimes, like we saw here, they can masquerade deficits if we are just looking at impulse. So something to kind of think about. If we look at if somebody's highly variable from rep to rep, then it just means they need more practice just doing Nordics. So maybe you just ditch the actual monitoring and tracking of their outputs and just say, hey, let's just train doing Nordics for a little bit. This is a great kind of way in which you guys can monitor return to play. So obviously pain monitoring is always going to be helpful for individuals. When we think about palpation assessment, we know that total length of tenderness is going to be a prognostic indicator. However, there's kind of this trope that people assume that also the distance from the ischial tuberosity to the location of pain is also an indicator, but that hasn't really checked out as well. So most of the time, people just say once the total palpation tenderness decreases by about a third, you're actually about halfway through rehab, is like the kind of colloquial terminology. It's tough to say that like factually and say yes, that is always going to happen. But it's just something that if you work in outpatient orthopedics and you're working with somebody, you're like, yeah, okay, like we're starting to see progress here. When we look at range of motion monitoring, doing something like the maximal hip flexion active knee extension assessment to consistently monitor range of motion is going to be really helpful. And then, like we talked about at the very beginning, long lever or outer range muscle strength is going to be a really helpful proxy for fascicle length. Finally, when we look at strength and running speed, a very helpful heuristic is going to roughly match the percent strength recovery that they have. So if you have pre-injury data or asymmetry data, then you can use that for their running speed. So if you have an 80% asymmetry or something like that, you could potentially work up to 75 to 80% of their maximal running speed. Again, it's going to depend on the individual and their running strategy, and so you have to use your own clinical judgment for that. When it comes to frequency of testing, I would say that it's it always is going to depend. When it comes to something like range of motion or palpation, you could do that daily or whenever you see the individual because it's quick, simple, easy. If you're looking at assessing somebody to see did they get stronger, then you have to incorporate your own idea of like how long does it take for a muscle to increase strength, right? So some generic timelines and those sorts of things of normally you only test every so often as you would assume an adaptation to occur. However, when we think about rehab, those adaptations happen a little bit faster because pain masquerades a lot of those sorts of things, right? So when it comes to rehab, you may test, once a week or once every 2 weeks, once every 3 weeks, just because you know that this individual is recovering at a faster rate and their capacity is going to change on a day-to-day or week-to-week basis. However, when we look at performance profiling and saying, hey, did this person get stronger after a training block or after a speed block? That would be, maybe 6 to 8 weeks. Maybe you could do a periodic, 4-week assessment if they're new to being assessed on something like this. However, anywhere within that range is kind of totally fine. It's also one of those things like you can test them every day if you want. It's just what are you going to get out of that? So I'm just gonna fast forward. This looks like a very useful thing, but I think I have something better. Yeah, okay, perfect. So when we have different stages within the rehab process, right? This is very basic, right? Protect and activate immediately after the injury, right? You do your kind of typical, like try and either promote a little bit of blood flow, get a little bit of swelling out of there, make sure that there's a little bit of early loading, all these sorts of things. Then we go to our strength and control phase, kind of PT school 101 stuff. We start to build into some eccentric tolerance so that individual can start to improve their fascicle lengths or increase their fascicle lengths. We start to get into, in combination with more resistance training, we see some more sport specific conditioning drills and some change of direction, some maybe locomotive drills if people are familiar with dribbles and those sorts of things. That's when you'd start integrating that. Then we look at training integration, return to sport, return to performance. This is all that continuum of if you're a PT working in outpatient orthopedics or something like that, this is when you start to hand over to the strength and conditioning staff and say, hey, make sure that this person is still getting, with their quote unquote high speed days are still only in the 70 to 80%, and then 80 to 90, and then 90 to 100 over time. And then all of these sorts of things, when we see light, medium, heavy, that's just in terms of the total volume and session duration. These are some very easy proxies, right? If you have a pain-free single leg squat and you can pain-free bike at 150 watts for 5 minutes, you know that some amount of improvement is occurring. Again, these are all arbitrary. I didn't say the depth of the squat. I didn't say, anything along those lines or the height of the seat or those sorts of things. So like, again, a lot of these sorts of proxy measures are just simple things that are easy to execute that anybody can do and say, hey, if you did this, that means we're getting better, right? So that's kind of what we look at there. And then when we look at some of the more big markers of things that we want to hit, I can go through when we're looking at mid-stage rehab. Hopefully, you guys will, or hopefully somebody, the patient will have hit all of their accessory muscle benchmarks. And what I mean by that is if you're training calves, if you're training quads, if you're training glutes and adductors, by the end of your mid-stage, all of those should be completely topped up and ready to go. So you should be hammering at least once, hopefully twice a week. If you can get that individual to hammer some machines, you just do a ton of calf raises or isometrics, knee extensions, the hip ab and abduction machine, hip flexor fallbacks. All of those sorts of things are going to be really helpful early on because you know that pain and total tolerance and capacity of the hamstrings is going to be a limiting factor for total exercise volume. When we look at light running, right? We talked about the dribbles and all these sorts of things. And then you can slowly start to find integrated movements where when we know that the knee and the hip and the ankle are all up to par when it comes to their capacity, we can start to find integrated movements like a Cossack squat, a hip thrust, a squat in general, a lunge, those sorts of things that can start to activate hamstring in a compound movement, as long as you're still doing some sort of isolated training as well. Like we said before, we're looking for improved outer range strength. By no means are you back to 100%, but maybe that 70% asymmetry mark would be a good target. Again, everything's arbitrary. If they have a really bad other side, then 70% doesn't really do you much good. Um, then we look at just kind of like quality executed exercises. And then this is a quick and dirty, like if they can hit a 2 times body weight isometric calf assessment, if they can hit 3 Newton meters per kilogram on knee extension and hip ABAD, or if they can do, over 350 Newtons and a 1 to 1.1 hip AD/AB ratio, then they're probably looking pretty good for that stage. Then when we look to end stage, again, we start doing Nordics, resisted Nordics, RDLs, walking lunges, all of these sorts of things that we know are going to load the hamstrings even more. And then we start running progress from 70+% of maximum sprint speed all the way up to, again, if you are the sole provider, then yes, you are going to start doing some sprint coaching and speed coaching. However, this is kind of the point where once they get a couple exposures at 70, 80, maybe even 90%, you're kind of like, all right, at least from my perspective, as a rehab provider, you guys can probably handle the rest. I know enough to be dangerous when it comes to sprint mechanics, but I would not be fully confident to say, yes, you are going to be perfect if I work with you. So that's kind of where I go from.
I have a
Finally,
question kind of backtracking on the
yeah.
mid stage. I
Mhm.
was curious, have you seen anything or like any recommendations on the difference between a proximal hamstring injury, like something that's more towards the ischial tuberosity compared to something
Mhm.
that's more distal, crossing the knee, like from a testing standpoint, like something more proximal that's, a little bit more related to the hip,
Mm.
and, like not tensioning that as early, having that more in a neutral position, maybe closer inner range, like 90 degrees to start versus prone 30 or having something like in a hip flex position. Like is there any recommendations on that?
Yeah, so nothing like super hard and fast based on research that I've read. I don't necessarily have a like, oh yeah, if it's proximal, definitely do X, Y, and Z. However, I think common just kind of anatomy-based heuristics can help where if it's going to be a proximal based injury like proximal hamstring tendinopathy or an actual um, intramuscular tendon tear or something like that, um, generally you'll probably want to stay away from that, hip flexion dominant eccentric kind of hamstring loading at the beginning. So I'm a big fan of just going in. If you picture in the gym, every now and then you'll see the kind of upright hamstring curl machines where you lean on your forearms, right? And you can just kind of hang out right there. Normally those are pretty well tolerated because you're pretty much just in a standing position, right? And then you can only do a very knee flexion based exercise. But from there, to be honest, I wouldn't necessarily think that there's anything super specific. Once you get to end stage testing, that's when I might like modify an IMTP or something like that to then have that person be super far bent forward and look and see, hey, can they pull equally from a hamstring perspective? Assuming you guys have force plates, which I believe you guys do. But if you can do something like that, then okay, great. You can then kind of modify and mix and match the assessment itself to that individual. You can also try out racer curls, but they're very notoriously difficult for people to do well, just because they're very demanding on the hamstrings. So those would be my areas to look into. But again, nothing hard and fast on that.
Appreciate you. Thanks.
Yeah, no problem. And then this, again, I know I didn't send Nick or Daniel the slides ahead of time, but I am more than happy to share these with everybody afterwards. So this is just some very basic, medical criteria, functional performance, strength symmetry, all these different things that are just very common, heuristics that people can follow of saying, all right, medical criteria, if you have pain-free passive and active range of motion, you can probably progress on to the next thing. If you are starting to, showcase really high quality sprint mechanics, then you're starting to look pretty good. If you have, psychological readiness and strength symmetry, all right, you look like you might be ready to start, getting back into practicing again. So these are just sort of really basic benchmarks and more or less no hard and fast numbers, but just like heuristics that people can follow. But yeah, but I will say, like I said before, a lot of my job is creating a lot of these educational resources. And we're very soon going to be coming out with both an advanced force plates guide as well as a hamstring injury guide. So a lot of the information that you guys saw throughout here is coming from that hamstring injury guide, as well as we have plenty of other areas for you guys to dive into, from blogs to a podcast to um, a bunch of different practitioners' guides. So these are all probably 60 to 70 page documents that outline very detailed outlines of what to do when it comes to hip and groin injury, ACL injury, calf and Achilles injury, force plates, and all these other things. So that's my kind of subtle plug for VALD of this is all free, all just housed on our website. So if anybody's looking to understand tech a little bit better, a little bit more, please reach out and see if there's any resources that are of interest, or just shoot me an email or a text or anything like that. I can give you guys my contact info. But yeah, right on the dot at 6. I don't know if it was supposed to be an hour, but we nailed it, I think.
Daniel and I are notorious for going a little over, so we appreciate everyone in the group that's still on the call. And Dylan, that was awesome. We really appreciate what you do for VALD and making these resources, and yeah, taking the time this evening. We do have a few questions, if you don't mind, if we can circle back to.
Yeah, for sure.
Yeah, so we have one that is, I'm not sure if you have one handy or something that you can refer people towards, but what does the ideal force curve look like for a Nordic?
That's a really good question. So, like,
Or
it's
or yeah, your prep or
hmm So I will say, like, let's see, if I go back up to those Nordic traces, there was one that kind of had this dashed or dotted line above it. So I would say, again, this is probably the best looking force curve, right? That I would see. Honestly, what you want to see is just a rapid rise, right? So you can see that even at short muscle lengths, they have high rate of force development properties. You want to see a steady, symmetrical, nothing wavy or jagged, right? And in a perfect world, you see a really steep, steady rise with that's very smooth, a very small, a very small plateau at the very end, just to showcase that they're able to decelerate and hold their momentum at the very end, and then a rapid drop, meaning they then relaxed, right? So normally when it comes to testing the Nordic on a Nord board, we don't recommend that people do like that push up and like use their hamstrings to pull themselves back up. It's just only an eccentric test. So when it comes to the perfect one, in summary, it would be smooth trace, so not bumpy, symmetrical. You would see a high peak force and a lot of impulse. And we Nordboard doesn't measure RFD, so you just have to see that the slope itself is steep. And then finally, you just see, like you can see here, this barely plateaued end spot, and then it dips.
Then we have another question here. Is it Haley or Hallie?
Hallie, yeah.
Oh
Hi.
yeah, perfect.
Hey.
I just have a question about like your guys' path and how you kind of got into the position you're in coming from PT school, not just like a sports science or data analytics or programming background. Um, did you expect to get into this arena when you were in PT school, or did you expect to become more of like typical PT or sports PT?
Yeah, I mean it's a great question. To be honest, I pictured that I would be in like Nick's position or something similar, you know. But
You
anyway,
do no rehab, like you just work for the VALD and for sports
yeah.
science.
So I do still work as a practitioner, and I treat patients weekly as well, and coach weekly. So I still have my hand in as a practitioner as well. However, a lot of my time is spent working for VALD. It originally actually happened just because my now wife is a PA, and she was going on her clinical rotations. And so I had just graduated. I had worked in a sports clinic for a couple months. And her rotations were kind of all over the place. And so I was reaching out and trying to figure out, can I do remote PT? Can I do this? Can I do this? And so I started working for VALD just as a way to just pretty much be able to still survive. And then it turns out it was just like all of the things that I was really interested in, kind of all jam packed into one thing. I could talk to the practitioners from a rehab side of things that I really looked up to, and I got to learn a lot from them. I also got to kind of get a lot of a great exposure when it comes to trying out new resources and trying to do new things. And so I was originally introduced to VALD because one of my clinical rotations while I was in PT school, the clinic that I was at was looking for some of the tech. So I got introduced to one of the reps, and they tasked me with like figuring out what tech they wanted and stuff like that. So I chatted with him, ended up saying, "Hey, are you guys hiring?" And he was like, "I have no idea. You got to talk to my boss." And so one thing led to another, and that's kind of how that happened. Um, but yeah, I mean, it was not at all what I was expecting. I was going to PT school thinking I was going to be a practitioner for life, and like that's all I was going to do. But I mean, it was a cool opportunity, and yeah, I love what I do.
Awesome. Do you use more of your tech stuff for rehab, like exercises, or are you using the tech to figure out where the injuries are coming from, or both?
Yeah, so both. So NordBoard, the tech here, has a training mode, right? So you can set a bandwidth and say, hey, I want this person to execute a test with this amount of asymmetry, biasing either the quote unquote good side or the quote unquote bad side. I want it to, have the effective threshold of you meet a certain amount of force or you meet a certain amount of impulse in order for the rep to become quote unquote effective. And you can kind of set different things like that so that when that person does the repetition, you can say, all right, cool. How is that from an exercise standpoint? So there's plenty of options when it comes to exercise. I would say when it comes to assessment, I use the tech. I don't know. I use at least one piece of the technology daily, probably just based on the people that I interact with. But if it was one specific patient that I used it, I would say probably, once a week, once every 2 weeks. So yeah,
Great. Thank you.
of course.
Along with that, we have another question too. So, Dylan, have you used the tests here to monitor fatigue or readiness? And then have you integrated them with other data sets to correlate with potential injury and monitoring?
Yeah, so being involved, we have a very large normative data lakehouse, so we get to compare things to different standards, and if you have Vault systems, like I can log into my fake Vault Hub account and show you guys, but if you go into Vault Hub and look up some sort of a Nordic, I'll just make sure that I'm on my fake account. But if you do that, then you can like look in and look at a profile or look at we can kind of just search for like somebody, we already have it pulled up on Nordboard. So the thing that I'll normally do is perfect. We have a hamstring strain case study. So we look up hamstring strain, find this person. And this is like what the dashboard will look like. Once it loads, it will show you that there's comparisons to normative data based on that person's age or based on that person's. Oh, good. It's been a while. Okay. Anyway, I'll show you just a normal profile then. If we just go ankle sprain or something like that, it will be able to show you, this person is at the 75th percentile or the 12th percentile for their group. I guess this is crashing on me. But another option that we have are normative data reports. So we also have a bunch of different PDFs saying, cool, if we have an adductor related groin pain person, or we have somebody who works in women's netball, or we have hamstring strain, or we can even get down to like if you work in the NCAA or something like that. Of course, none of these search functions are working for me. But anyway, there's a lot of data out there that we can use to monitor it. What was the first part of the question again? Oh, monitor fatigue. Yes. So what I would say there is there's certain metrics and certain things are going to be more or less sensitive to fatigue. RFD is obviously going to be number one. However, RFD is just incredibly sensitive overall, and it's not super reliable. So the biggest thing that I look at when it comes to fatigue and things like that is either we do jump testing and we can look at different fatigue markers through force plate testing, or you can just do a simple range of motion screen, right? If that's all you have afforded to you and it's a hamstring case, most of the time, if somebody's fatigued, their hamstrings are going to lock up, right? So that range of motion deficit is going to be a large factor as well. So that's that's kind of where I would go with it.
And I think another thing that like Dana and I have talked about too is just adding context to the tagging. And if you're testing that athlete, you know, after a game, 2 or 3 days after a game, like making sure that you're consistent in the tagging so you understand the context of when the athlete is testing too. So that's um yeah, stuff Daniel and I have talked about, and Dylan as well. So hopefully
Yeah,
just
no, that's huge. Yeah, being able to do that and understanding even like game load, like Daniel, I'm sure you can attest to that from like a heavy practice or something like that, having a lot of the monitoring tech that you guys use, but trying to be able to corroborate and say, okay, well, when this metric tanks, it's likely because they experience like a increased volume of a certain band of running speed or something like that post practice or whatever it is. So yeah, there's plenty of options that you guys can dive into if you have the time and resources to do so for sure.
Dylan, that was awesome. We
Thanks,
really
guys.
appreciate that. It was all, and
Thank you, Dylan. That was amazing.
I know I'm
Oh,
looking
no
forward to
problem.
the hamstring guide here. I'm just going to share my screen and we'll wrap up
For sure.
tonight. And
Exit
I
out of
feel like
there.
this is something that we could talk about for probably another hour, 2 hours, 3 hours.
Oh,
So
for sure.
I
Yeah.
feel like this will be TBD or to be continued. So
Mhm.
we'll kind of move on here. Daniel, if you want to wrap us up.
Yes. All right. So we will have another guest speaker this coming Wednesday and Tuesday in 2 days. It'll be Quinn Sandler. He's the CEO of Plantiga, and he's going to talk about Plantiga applications within athlete monitoring, as well as a specific rehab case study on how they utilize their technology with return to play. Thank you so much, everyone, for being here. Thank you, Dylan. That was incredible, awesome learning experience for me personally. I know everyone here found it really useful as well. Um, if you guys want to follow some of our work, as well as tap into other future talks, you could follow us in our CPSS Prep Facebook group or on Instagram and YouTube. So this call is going to be recorded as well if you guys want to refer back to it, and will be uploaded to our YouTube channel.
Awesome.
And
Thank you
then
guys so much. I might have to duck out real quick, but I really appreciate everybody's time and thank you all. If there's anything you guys need to chat about or anything, Nick, Daniel, you guys can give them my contact information or anything like that, and more than happy to chat.
Perfect. Thank you, Dylan.
Awesome.
Appreciate your time.
Thanks, y'all.
And then finally, we just have two resources that we want to plug quickly. So Nick and I, we help develop sports science resources that help you gain sports science hard skills. The first one is our CPSS prep. We walk you through every chapter in the NSCA Essentials of Sports Science textbook. We know that there's a ton of content, so we also focus on which topics are really important to pass the exam, as well as different applications as to how those concepts are utilized in real life, so that after you pass the exam, you'll have the certification as well as some knowledge on how to apply those concepts within your work or future jobs as well. And then the final resource is our R for Sports Science course, and that teaches you kind of how to utilize data and code the way sport practitioners do, kind of similar to the talk that Dylan's going through on VALD products. We also run through a VALD data set to kind of demonstrate how to code in R for sports scientists. And then to utilize those resources, you can just go to sportscience.podia.com, and then you'll find all of our resources there. That's all we have for you guys tonight. Thank you so much. Nick, is there anything to add?
No, I just echoing that. Thank you guys for your time and the questions, and look forward to having more of these talks. And any recommendations that you guys have for topics, we're always looking to improve and have people on. So any input is appreciated. Thank you guys.